All right, let's get our guest on. Hi, everybody. I see we already have somebody online. Thanks for joining us on this edition of 39 Down, our podcast, our Mind Body podcast. And today we have a special guest. Dr. Lexi Harrigan is with us today, and she's going to help us explore and teach us on a very important topic, things that we don't know are important. So, welcome, guys, for being. Thank you for being here, and thank you, Doctor, for being with us
Thank you.
today.
Thanks for inviting me. This is going to be great. I'm really excited.
Awesome, awesome. Well, I want to read your bio, if you don't mind.
Sure.
Introduce you to the people, and then we will get started. Okay. So, Dr. Alexia Harrigan is the owner and founder of PelvisPower PT in the Dallas-Fort Worth Metroplex area, and over the past 17 years, she has treated orthopedic conditions, sports injury, women's health issues, and our topic of today, pelvic floor dysfunctions. And her mission is to educate and empower her patients to take radical ownership of their health and achieve their highest quality of life. So that is a great mission to with for me. It aligns with what I am doing, and I will be honest with you, like I said, I don't know much about pelvic health, but I saw a post that you were talking about it. And I said, I wonder if she would come on and explain a little bit of this to us. So thank you. Thank you for agreeing to be here. And thank you for taking the time to teach us today.
Yeah, I'm really happy to be here.
All right. Well, let's get right into it. So, like I said, I know we all have pelvis. And what I know about it, I'll tell you what I know. I know that when I sneeze, okay, I know that when I sneeze, when I laugh, when I blow my nose after I've had three children go through
Mhm.
my pelvic area, there are some leaks and there are some issues going on. And I know that I can be fixed. Um, I have not done much to do it, about it. And so that's all I know about pelvic health. Of course, it's supporting us. Don't know what it supports, but you have the floor.
Yeah, absolutely. So like you said, everyone has a pelvic floor, and
Mhm,
everyone has a pelvis, women and men.
mhm,
Um, and so, really, what pelvic health is, it's a broad spectrum of things, but more specifically, pelvic floor physical therapy, right? So, with your pelvic floor, the muscles of the pelvic floor basically are the last stop before you get to your legs in
mhm.
your body, right? And that's your pelvic organs, so your bladder, as far as women, your uterus, or men, their scrotum, their penis, all of those things are supported by the pelvic floor, the rectum as well. And then you have, the abdominal organs, so your stomach, your GI, and all that is on top of that. And then you kind of work your way up. So the pelvic floor is actually the floor of the trunk.
Mhm.
And so, with that, it has a lot of great responsibilities, right? So, it supports all those structures. It also has sexual function. It also functions for continence. So, helping you not leak, helping you pee, helping you poop. It also has function with your breathing. We'll talk about that a little bit more too. And it also is very unique because it is connected to our neurological system. So the nerves that go to the pelvic floor are not just motor, where they contract and relax. They're not just sensory, where we feel, but they're also autonomic. So that fight, flight, or freeze system,
Mhm.
it's connected to that. So when you freak out, your pelvic floor freaks out. That's just kind of
Interesting.
how we're
Mhm,
hardwired.
mhm.
So you might find that if you're nervous or you've got something really pressing or you're really stressed, you might be running to the bathroom a little bit more often,
Mhm, mhm.
right? Or you might have pelvic pain, or you might have constipation, or all those systems are connected to
Right.
your nervous system.
Hmm.
And so, as you kind of relate all those things, the pelvic floor is really an amazing place because it's connected to everything.
Mm.
Yeah.
That is, yeah, I never thought about it. Again, I guess something we don't think about, but when you give those examples, like, oh yeah, that's why you cramp up, or you have to run to the bathroom, or you can't go, when you're stressed out, for example. I never thought
Hmm.
about that being connected to, in terms of the autonomic, nervous system. So that's interesting. So it's right there. It's supporting everything. It's at the bottom
Hmm.
of our bag or our basket. If it breaks, then I imagine something's
There
bad
can
happened there.
be, yeah, there can be some issues. So
Hmm.
if you think of your pelvis, so if you put your hands on your hips, right,
Hmm.
all of that you feel,
Hmm.
that's your pelvis. And
Okay.
it's kind of like a bowl. And I wish I had my model with me, but I don't have it today. But it's kind of like a bowl, the pelvis, and that's what your leg bones, your femurs come off of.
Hmm.
But everything connects to that. Your tailbone is on the
Hmm.
back, and that bone right there in the front, that pubic symphysis, it's kind of below your belly button, that hard piece right before
Hmm.
you get to your genitals.
Hmm.
That's your pelvic, that's your pubis bone. And so that's the two areas where they kind of connect together,
Hmm.
is that front part, that pubis bone, and then your tailbone or your sacrum,
Right.
and your sacrum kind of in the back. So it kind of wraps around like this,
Right.
bony structure wise. And then you have the muscles, that connect kind of like in a bowl,
Hmm.
and that's your pelvic floor. And there's
Right.
layers of those muscles that function, um, for support. So those muscles, like, they contract and they also lift.
Hmm.
And it's kind of like if you were going to pick up a grape, right? So the muscles kind of come together and then they lift like that, if that makes
Okay.
sense.
Right.
So
Yeah.
they contract and lift
Hmm.
in that bowl.
Hmm.
And so when we've had babies, right? We've had this big old baby head barreling through all that pelvic floor, that pelvis
Hmm.
area, and stretching all those tissues. It affects how those muscles function. And
Hmm.
so, because of that, there can be lots of things that can happen. There can be pain that's a result, there can be tearing that's a result, there can be leaking, urinary or fecal. Um, there can be a lot of different things, pain with sex. There can be a lot of things that can happen, through childbirth, but they're not exclusively through childbirth either.
Right. That was going to be my question, because if a woman who has not had children, or a man, will say, well, this does not pertains to me. Those things don't affect me, or maybe it's a different reason why I had, those issues. So how does it affect? How would other people who have not had, the childbirth experience, how would they have those issues?
So some individuals may have, what we would call like an, increased tone in the
Hmm.
pelvic floor. So typically, now I'll start with women and then I'll go with men.
Hmm.
We'll start
Okay.
there. So with
Okay.
women, especially ones that have not had children, they can still have incontinence. They can still have pelvic pain, pain with sex. They can still have frequency of, urination, always going to the bathroom. They can have
Hmm.
constipation, all those things. They can still have that even though they haven't had children. And a lot of times, what can happen is there's a lot of tone in the pelvic floor, meaning, so if you envision your pelvic floor, right, like it contracts like this and lifts, right? And so the level of contraction, if you think about it, if we think about our pelvic floor kind of like an elevator,
Okay.
right? So on floor one, we're kind of just ready for anything,
Hmm.
okay? And then if we did a maximum contraction, maybe we came up to floor five, let's
Hmm.
say. And then we relax, we come back down to our first floor,
Hmm.
right? So we've got this kind of action with our muscle. Now, when someone has some increased tone, they might not be resting at their first floor. They might be resting in floor three.
So they're in a certain state of tightness or contraction in a way,
Hmm.
when they're not supposed to be. Mm.
Correct.
Mm.
And one of the misconceptions, that a lot of people have is that you only leak. Now, we'll take
Mm.
leaking, for example. You only leak when you're weak,
Hmm.
right?
Right.
Which is
Well,
not
that's what I
true,
was
which is
seeing.
why Right, which is why so many people say, "Oh, you should just do Kegels," which are like pelvic floor contractions. "You should
Mhm.
just do Kegels, just do Kegels." No, stop. Everyone stop doing Kegels. Just
Oh,
stop,
wow.
right? Stop it. Because you don't know why you're leaking. And so the
Mhm.
reason, I'll give you an example. If I
Mhm.
was gonna throw you a ball, right,
Mhm.
and your hand was weak, the
Right.
ball would fall right
Right.
off.
All that.
Couldn't
Right.
catch it,
Mhm.
right? Likewise, if you balled your hand up in
Right.
a
You still
fist,
can't catch
you
the ball.
couldn't catch it either,
Mhm.
right?
Mhm.
And so for this person who has more tone,
Mhm.
doing more contractions is
Doesn't
gonna
help.
make it worse.
Right.
It's not gonna
Yeah.
help, right? So we can't just blanketly say, "Oh, just do Kegels because you're
Mhm.
leaking."
Mhm.
No, let's find out why. What's
Right.
the culprit here? Who's not doing their job or who's working too hard? Because
Mhm.
that can be a thing.
Right. So how do you again? So how do you get to this extra tone? Is it an accident or how does that happen?
Well, there's a lot of reasons why people can have
Oh,
increased
okay.
tone.
Mhm.
Some people are just more tense individuals. You know, the type A, I can never
Mhm.
relax, always got to do something,
Mhm.
high stress. Like we talked about earlier, the
Right.
pelvic floor is connected to your nervous system, your autonomic
Right.
nervous system. So if you're always in a state of tension, right, or if you're
Mhm.
always holding tension in your shoulders, you're
Right.
probably always holding tension in your pelvic floor too,
Hmm.
right? And so that can result in urinary issues because one,
Mhm.
if all I can function with is
Type.
this,
Uh-huh.
I can't, I need to be here so I
Right.
can I can catch and release when that
Mhm.
pressure comes down for me that, when I
Mhm.
sneeze or cough or whatever. But if
Right.
I'm here, I can't stop much,
Mhm. Mhm.
right? So there's that. So someone that has just that increased tone can have that, or if they've experienced any kind of trauma,
Mhm.
and it doesn't have to be sexual, it can be many different kinds of trauma, but
Mhm.
that can definitely affect the pelvic floor.
Mhm.
Obviously, any injuries they may have had
Mhm.
could also lead to that. Um, Also, GI issues can
Mhm.
have that as well, or women with endometriosis, which is
Mhm.
basically where the lining of the inside of the uterus starts growing outside of the uterus and
Mhm.
affecting the organs surrounding it and causing a lot of pain. So,
Mhm.
if someone's had a lot of pain for a long time, and it doesn't necessarily have to be endo, but it could be chronic low back pain or whatever, that's going to increase tone in the pelvic floor as well.
Right.
So there's multiple reasons why someone could have that.
Mhm.
As far as men can have pelvic pain. They can
Mhm.
have urinary leakage. They can have fecal incontinence. They can have constipation. Even men that have had, like, they've had prostate cancer and have had
Mhm.
their prostate removed, they have a lot of issues with leakage and erectile dysfunction, things like that. And all those things are affected by the pelvic floor.
Mhm. And if it's not prostate, it can be maybe the same thing that you talked about. The toning can be
Hmm.
an issue. So
Hmm.
uh, healthy, fit, healthy, the type A, high stress type of man can have some issues that we wouldn't expect.
Yeah,
Can have the
absolutely.
same issue. So it may not be leakage. It could be constipation. Or it can be something, something like that.
Hmm.
And
It
we're
could be
not seeing
pain.
it could be pain, and even so, you talked about the lower back pain too.
Hmm.
So having the pelvis area can actually affect the back, or the back
Oh yeah,
affecting the.
big time.
So that's
Yeah, big
interesting.
time. They can actually feed into one another. It's like, you hurt,
Mhm.
okay, I'm gonna hurt too, or you're tight, okay, I'm gonna be tight too,
Right.
because of the way the nerves run throughout the
Mhm.
body, right? So
Mhm.
in the pelvic floor, the nerves that innervate the muscles in the pelvic floor come off the spine
Mhm.
and also flow in the same tracks as the low back. And
Right.
so because of that, those muscles,
Mhm.
those nerves will talk to the muscles and everything, and will get kind of
Together.
crazy.
That's very interesting because again, I'm thinking about back pain, and I'm again looking at painting the nice fit person, male, female, and you were thinking I have some back pain, maybe because I'm exercising, and it may be too hard, or I pulled something, it's all, maybe I lifted something, or I turned. But we don't think that it could be that, but it can also be, the high stress level. It could be so many other things,
Mm-hmm.
and how, trying to take something further back may not solve the issue if the back and the pelvis are communicating. If you fix only the back and you don't fix the pelvis, then you're actually not helping, or not fully dealing with the situation. That's very interesting.
Yeah, and it really just depends on the symptoms. Like what is like in
Right.
because of my background and I've worked in orthopedics for a lot of
Mm-hmm.
years, I kind of now that I'm doing pelvic health,
Mm-hmm.
I see so many connections, and I work all the way up the chain as far as like, okay, well, you've got pelvic floor issues, but let's make sure we look at your hips, and let's make sure we look at your back, and how are
Mm-hmm.
you breathing, right? Because they all are connected. And I've had so many patients where, they came to me for pelvic pain, and we kind of started getting the pelvic pain together, but then there was something funky going on with their back, and I'm like, let's pause the pelvic pain part. Let's
Mm-hmm.
really work on this back. And once we work on the back and the back gets better, the pelvic floor gets better.
Mm-hmm. Mm. Very, very interesting. So, what are the signs? And again, the symptoms can be symptoms of different, dysfunction, different situation. But let's say if I'm wondering, okay, do I have, now that you're saying that so many people could, have those issues and not know, what kind of symptoms, what things should I be looking for, to point out, maybe that'll point out to pelvis issues.
Yeah. So if you're having any leakage, because leaking is not normal,
Mm-hmm.
like
Mm-hmm.
any leakage, leaking is not normal. Even though we've had babies
Mm-hmm.
and, the structures are different now
Right.
because we've had babies,
It
leaking
still
is
should
still
not.
not normal.
Right.
And even though, right, because even though it's common, very
Mm-hmm.
common, but that doesn't make it normal,
Mm-hmm.
right? So that's one of the things that I think that we as women kind of push things to the side, or
Mm-hmm.
kind of get conditioned. Oh, you're just a woman. This is just what happens. Oh, you're
Right.
just getting old. Oh, it's because you had babies. It's fine. This is just your life now.
Right.
No,
Right.
ma'am. Like there's treatment for this. You don't have to live like that.
Mm-hmm.
And if you just want to manage it, cool. But if you want to get treatment for it, it's there for you. But a lot of people don't know that there's treatment. They just think this is just their life now.
Mm-hmm.
And so with that, if you're having any kind of leakage, urinary or fecal, um, if you're having chronic constipation, now
Mm-hmm.
most people don't realize that constipation, like people's definitions of constipation, like personal definitions, are their perceptions are very different than the
Different.
actual thing, right?
Mm-hmm.
It so normal a normal bowel schedule
Mm-hmm.
would be anywhere from 3 times a day to 3 times a week.
Hmm.
So
Interesting. Mm.
right. So anything less than that, that would be constipation.
I would think you would have to have something every day.
Right. That's most people. They're like, oh, I'm constipated. It's like,
Right. Right.
no,
Mm-hmm.
not, I mean, not necessarily, and
Mm-hmm.
so 3 times a day to 3 times a week,
Mm-hmm.
you
Depending
know,
on what you eat, I guess, maybe, or how
yeah,
you
depending on
process
what
it.
you
Mm-hmm.
eat, depending on the consistency, right? So
Mm-hmm.
you always want your stools to look like a big banana.
Mm-hmm.
You don't want it hard pellets where you're having to strain,
Mm-hmm.
because that would be like, hey, you're probably leaning on the constipation side, right?
Mm-hmm. Mm-hmm.
But things of that nature, um, if you're having that, if you're having any pelvic pain, so any vaginal pain, any lower abdominal pain, any pain with bowel movements, any pain with urination, um, yeah, any pain with sex, um, like you should not have pain with
Mm-hmm.
sex.
Mm-hmm. Mm-hmm.
There are individuals that have waited till they got married, didn't have, they were virgins when they got married, they didn't know, and they've been married for I don't know how many years, and it was always uncomfortable, and they thought that's just what it was like.
That's what it is. Uh-huh.
But it's not,
Mm-hmm.
right? It's supposed to be amazing, it's supposed to be life changing, that's going to be painful.
Right, right. And so yeah, because then, if you don't know, or you have not had discussions, or you think that, okay, it's part of it, it's painful, but it's not supposed to be.
Mm-mm.
And there are ways to actually treat, again, exercises and different things that can be done, to help, and emotional also,
Oh
all
yeah,
of
big
that
time.
tied together from what you're saying. Yeah.
Hmm. Yeah, a big part is the emotional component. I send
Mhm.
people to counseling almost every week, several
Interesting.
times a week. I send
Yeah.
counseling all
Huh.
the time because, because of the neurological connection
Mhm.
of the pelvic
Mhm.
floor to the autonomic nervous system. If
Right.
you've got some undealt with baggage,
Mhm.
um, it's going to affect your pelvic floor,
Right.
and if you've got if you've got symptoms, pelvic floor
Mhm.
issues,
Mhm.
um, working on those things emotionally will help your pelvic floor.
Right. Right.
It just will.
Yeah. It makes so much sense when you say it. Again, not something that we would think about, and just the fact that the interdisciplinary type of approach, is very important, because when you see what you see and what you can do and what you can touch, and then having a counseling and having massages and having different things that can actually get you more of a well-rounded type of treatment, and long lasting type of treatment, instead of just trying to tweak and fix one thing that's going to break down again because the core of the issue was not addressed. So that's really good. Yeah.
Hmm.
And
Yeah.
again, both men and women, because some men will say, for example, well, if they have like prostate issues, and they will say, well, just like we would say after childbirth or age, oh, it's normal, it happens. And when you have had any kind of prostate issues, surgery or radiation or whatever, and then they say, well, that's just how it is. And even with that, although things have been damaged, there can be some repair, some improvements there.
Hmm. Absolutely. And with men, I find that I have like men in two different categories. You
Hmm.
know, Oftentimes, from what I've seen in my practice, I've seen men post, prostate surgeries. And then I've seen and most of them are older, but then I've seen a lot of young men
Hmm.
with pelvic pain, urinary leakage, and they call that like pelvic pain would be like chronic prostatitis. So basically, like inflammation in the prostate area.
Mhm.
Um, Oftentimes, with those individuals, they sit a lot, they have high stress jobs,
Mm.
um, they're on a lot of pressure at home. They don't take very many breaks for themselves. There's just a
Mhm.
lot of different
Right.
uh, biopsychosocial things that go on that
Mhm.
play a part in that.
Mhm.
And so, addressing the pelvic floor is just one thing, one part of it. I
Right.
always tell my patients, like, I love doing what I do because I get the privilege of looking at the body very holistically,
Mhm.
because nothing in the body happens as a silo,
Right.
everything's connected.
Right. 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 So how does so somebody has, let's say, now I say, okay, I do have some of those issues that Dr. Hagen is talking about. Maybe I have some leakage and some constipation. Let's just put some things. So how do I go about? Is it like I have to get an X-ray, or do I have to come to a PT and have you kind of touch everything and see what's going on? How do I go about finding out if I do have some pelvic dysfunction, pelvic
Yeah.
floor
So
dysfunction?
if so depending on what state you're in,
Mhm.
I definitely recommend pelvic floor physical therapy, hands down, to
Mm.
anybody.
For anybody.
To anybody. We all need it.
It's
Um,
interesting, yeah.
but but I would say, depending on what state you're in, sometimes some states have direct access
Okay.
where you don't need a doctor's referral to go see a physical therapist.
Mhm.
Some states require that you have a referral. So you kind of have to do that research yourself and figure out. You can also just talk to your doctor, be like, hey, I'm having these issues. I want to go to pelvic floor physical therapy.
Mhm.
Be mindful, your doctor may not know what that is.
Right. That was going to be my next question.
Yeah.
So they may not know, and do all physical therapists have some kind of pelvic floor therapy training, or is it a specialty? Or
No, they don't. So
mm-hmm.
in general PT school,
Mm-hmm.
now they get like maybe like an intro class, like, hey, this is what it is. When I was in school, way back when, it was not a thing.
Mm-hmm.
In school, I didn't even know it was a thing until way later. But not all PTs do this. It
Mm-hmm.
is a specialty, so you'll have to find um, a physical therapist that specializes in pelvic health, that's been trained in pelvic health. And that's really, wherever you are, that's a Google search, really.
Right.
There's more of us now than there were,
Mm-hmm.
but there's still not as many of us as there, as regular orthopedic physical therapists. So, go to your doctor and find a pelvic floor physical therapist near you. And let them know what's going on. So if it's
Mm-hmm.
leakage, if it's I just had a baby and everything feels different and nothing's working the way it used to,
Mm-hmm.
um, or I'm having pain with sex, or I'm having bladder issues, I'm having poop issues, whatever it may be, um, and just tell them what's going on. They'll do an assessment. You won't need an X-ray, um, but, but
Just
typically
fill
with
that
a
in.
yeah, no X-rays needed. But with an initial evaluation, because we are trained as orthopedic physical therapists, we do a thorough assessment of all the systems. So we
Mm-hmm.
look at your lower body strength, we look at your core strength, your breathing, your posture. Um, we look at any back issues. We look at your back movements and some functional activities. I often have my patients squat just to see what happens,
Mm-hmm.
because it tells me a lot about
Right.
how they use their body on a regular
Mm-hmm.
basis. So we do a thorough assessment there, and then we also do a pelvic floor assessment.
Mm-hmm.
And so typically, most pelvic floor physical therapists do an external and an internal pelvic floor assessment. Not all of them, but most of them do. Now, mind you, as a patient, you don't have to do anything you don't want to do.
Mm-hmm.
So if you don't feel comfortable doing an internal assessment, you don't have to.
Mm-hmm.
Like, don't feel pressure, because your pelvic floor physical therapist won't pressure you,
Mm-hmm.
but they will let you know, hey, this is what we can do, right?
Mm-hmm.
But it does give us really great information as to what's happening with your pelvic
Right.
floor, and can help us prepare the plan for you to get
Mm-hmm.
better.
Mm-hmm.
But with the external assessment, we will kind of look at the vulvar area, so
Mm-hmm.
around the vaginal area.
Mm-hmm.
So we'll look at the vagina, we'll look at the vulva, so all the tissues around, so the labia,
Mm-hmm.
majora, minora, so all the inside
Mm-hmm.
tissue there. We'll kind of see if there's any pain, any tightness, any increased tone. We'll have you like contract and relax your muscles to see how coordinated those muscles are.
Mm-hmm.
Because sometimes, you think you're doing a pelvic floor contraction, but it's not really happening like you think it is. You know,
Interesting.
so other
You're
things,
contracting other things, or just
yeah.
around it, but not the.
Oh yeah, people will
Mm.
squeeze their butt. You'd be like, no, that's not it. Or
That's
they'll just
yeah,
hold their
yeah.
breath. I'm
That
like, no,
makes
that's not
sense.
it either.
Uh-huh.
So so we'll see what kind of things they're doing with their
Mm-hmm.
pelvic floor there. Now internally, we don't use a speculum, that little duck thing.
Mm-hmm.
There's no stirrups, no speculum at a pelvic
Mm-hmm.
floor physical therapy assessment. None of that.
That's good.
Yeah, none of that. And basically, we just use like a lubricated glove finger,
Mm-hmm.
and we're basically feeling the muscles,
Mm-hmm.
within the vagina
Mm-hmm.
to see again, if there's pain, if there's what the tone is looking like,
Mm-hmm.
how well you're contracting, what your strength is like, what your contract reactions are, doing some quick contractions to see how coordinated those muscles are. But it gives us that feedback. Can you
Mm-hmm.
contract? Also, can you relax?
Right, because if you're
Because
too much tone, like you said. Mm-hmm.
right, so that's a thing. So we need contraction, we need relaxation, and we also need lengthening, right? So
Mm-hmm.
like going back to that elevator example,
Mm-hmm.
right? So if we're kind of just hanging out at our first floor and we contract and go up to our fifth floor. When we relax, we come down to our first floor, but we also have a basement, right? And
Right.
we lengthen those muscles down into our basement. We
Okay.
need that when we breathe. We need that
Mhm.
when we cough. We need that when we have bowel movements and things like that. We need that. We need all
Mhm.
those levels. And so we
Mhm.
check to see what's happening at your pelvic floor. So
Right.
in relation to your symptoms, now we can tie in some objective things. Okay, this is
Mhm.
what I think is happening here. And so we'll talk you through everything that we're doing. We'll tell you all the stuff up front. We'll guide you as we go along. That
Mhm.
way you're understanding all the stuff, because we're not just gonna be like, all right, lay down
Right.
and not talk to you, right? We're going to explain
Right.
all these things
Mhm.
because, it's really important that you understand what's happening
Mhm.
in your pelvic floor, right?
Right.
It's an area you can't see, right? If
Right.
I was going to tell you how to do like a bicep curl, you'd be like, oh, yeah, I got that, because you
Right.
can see that.
Right.
But with the
Mhm.
pelvic floor, we can't
You
see. And
can't
so
see.
the more
Mhm.
you understand about how your pelvic floor functions and what's happening there, the
Mhm.
better it is for you to be able to do the things you need to do to get better.
Mhm. Interesting. So, how would a male assessment go?
So with a male assessment, typically we do the same type of external assessment,
Mhm.
um, and then we do a rectal assessment.
Mhm.
So we would feel their pelvic floor muscles
Mhm.
through the rectum.
Mhm. Mhm. Okay.
And with women, sometimes we do rectal assessments, especially if they have bowel stuff going on.
Constipation and so on. Okay.
Yeah,
Okay. Nice. So, um, so how do we help? I would say maybe what kind of exercises, because I'm assuming then you have different exercises based on the assessment. You
hmm
talked about counseling already. Is there things that we should eat or not eat? Should we exercise? Are there different type of movements that are helpful at home? I'm assuming maybe sometimes people are too strenuous maybe on their exercise as well. So,
yeah.
what kind of, in general, I guess, because we can't go case specific, but in
Yeah.
general, what kind of things that, you would expect from sessions, and then, what kind of things can you do at home as well?
Yeah. So um, a lot of the things that I have my patients do, and a lot of it is case specific,
Mm-hmm.
because typically what's happening in the pelvic floor is not only happening in the pelvic floor. So
Mm-hmm.
there's often some weakness somewhere. There's always muscle imbalances.
Mm-hmm.
There's some tight muscles working too
Mm-hmm.
hard because there's some other muscles that are weak and not doing their job.
Right.
So that could be the glutes, that could be the core, that could be the back. So there's all kinds of things. So a lot of times there's a lot of strengthening exercises that aren't necessarily for the pelvic floor, but they
Mm-hmm.
support the pelvic floor.
Right. Right.
Um, so there's a lot of those things, and we will give our patients home exercise programs, right?
Mm-hmm.
So that they can do the things, because you might see me 1 or 2 hours a week.
Mm-hmm.
You're with you 24 hours a day,
Right.
7 days a week, right?
That's
And you're
true.
gonna get
Yeah.
out of it what you
Mm-hmm.
put into it,
Yeah.
right?
Yeah. Yeah.
So with that, we'll give different strengthening exercises and different even stretching exercises for the people that have, more tone.
Mm-hmm.
Um, we'll do a lot of those things. We do a lot of posture exercises. Um, but I think the best thing for anybody to do, whether you have pelvic floor issues or not, would be breathing.
Hmm.
I would say, I'd say
Interesting.
100%. If there's one exercise I give to every single patient, no matter
Mhm,
the diagnosis, is
mhm.
breathing, because
Breathing.
everybody does it wrong.
You know what? That is true. But I would say this, okay, and maybe you could kind of tell us how to do it right, because I hear that a lot. Everybody does breathing wrong, but then the person that's saying that is telling us how to do it, and then I hear somebody else saying everybody does it wrong, and they say tell me something different. So I'm like, at the end of the day, I feel like I'm still doing it wrong because I don't think I have the actual technique, the actual breathing technique. So
Yeah.
I understand, or I hear, through is your stomach should be, your belly should be going in and out, not so much your chest. I don't know. So tell us a little bit about that.
Yeah. So So I'll start by kind of explaining how the air gets in and comes out, right?
Okay.
Or how it should, rather.
Mhm.
So if we think about the rib cage, right? The rib cage wraps all the way around the body, right? And they move kind of in a bucket handle,
Mhm.
right? They kind of expand and then come back down.
Right.
And in the front, they kind of come like this. So it's kind of like a that when we inhale, right? So what happens is when we inhale, the ribs expand, right? And start filling with air. The diaphragm, which is our primary breathing muscle that's under the ribs, that
Mhm.
flattens.
Okay.
Then the organs lower to make room
Mhm.
for the diaphragm. And then the
Mhm.
pelvic floor also lowers,
Mhm.
right? So as you inhale, all the air should come
Bring it
down
down.
and in,
Mhm. Okay.
right? Therefore, when you exhale, it should come up and out, right? So there's this balance of pressure. So when you inhale, it should come down and in. When you exhale, it should come up and out.
Second, I'll say, as you're saying that, I'm there trying to do it.
You're like, okay, what do I do? Right?
I'm like, is it going
Like, what
in
do
or
I do?
not? I don't know. Stop
Right.
breathing.
Right. And so
Okay.
we want your belly to expand, but we don't
Uh-huh.
only want your belly to
Right.
come out, right? Because that throws things off, right? If you're only going like this,
Mhm.
right? We want more of like so Sarah Duvall, she's a prominent person in pelvic health. She talks a lot about 360-degree breathing, right? Because we want not just the front of the ribs to
Mhm.
expand, not just the
Mhm.
sides, but also the back. So we
The
want
back.
everything around to open. So
Mhm.
as you're inhaling, your belly is going to come out, but it shouldn't be the only thing moving, right? We
Right.
want more of if you vision an umbrella,
Mhm.
right? So you have an umbrella and the whole thing opens,
Right. Right.
right? That's how you want to breathe. You want to breathe where it comes down and comes up and
Mhm.
out.
Okay.
So the easiest way to kind of figure that out is if you put one hand on your chest, one hand on your tummy,
Mhm.
and then you inhale through your nose, exhale through your lips.
Mhm.
As you do that, take note of what rises and falls first.
Mhm.
Don't fix anything, just see what you're doing naturally. Some people, their chest is going to be the only thing, when their chest rises, their stomach sucks in, and then when
Mhm.
they exhale, it's more
Right.
like,
Mhm.
but think about it this way. If I breathe that way, right? If I'm breathing that way, what happens when I sneeze?
It
All
goes
that
down.
pressure, all that pressure hits the
Right.
bladder on the head. Now, what's the bladder
Right.
supposed to do? It's going
It
to
has
leak,
to
right?
release. Yes. Uh-huh. Uh-huh.
Right? Because all that pressure came down. Now, what
Mhm.
would happen if when I inhale
Mhm.
and then when I exhale, and the pressure
Right.
comes out this way, my pelvic floor comes up, my core supports me, and then I'm not leaking.
Right. Everything is coordinated, working together. Okay. Okay.
Exactly.
Hmm.
Exactly. So it's one of those things, it's going to be very counterintuitive. And
Mhm.
it's not really counterintuitive because the body is designed to do this, but it's countercultural,
Mhm. Mhm.
right? Because when we see
Okay.
on TV, the doctor's putting the thing on you,
Right.
in the movies or whatever, and they're like, take a deep breath, and they're like,
Yeah.
that's how we, it's cultural. It's
Mhm.
cultural, but it's not primary, it's not great for your body. Will
Mhm.
you live? Yes.
Yes.
You won't die if you breathe that way, but you probably won't have optimal pelvic floor function.
Right. 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 And it also helps with stress and different things like that as well, right?
Yes, and this is why I love the body, right?
Mhm.
So when we do these, what we call diaphragmatic breaths, right? We're
Mhm.
engaging that diaphragm and we're bringing that air down.
Mhm.
When we do that, one, we lengthen our pelvic floor down into the basement. So that's
Mhm.
helpful, especially for
Mhm.
those who have tone,
Mhm.
right? When we do that, that diaphragmatic breathing stimulates the parasympathetic nervous system.
Mhm.
And that is the calming part
Right.
of that fight, flight, or freeze system.
Mhm.
So guess what? When we do our breathing, we're stretching our pelvic floor, we're lengthening and bringing it down. We're also stimulating our parasympathetic nervous system, which is also calming our pelvic floor down,
Mhm. Nice.
right? And it's
Mhm.
like
Mhm.
crazy. And even like for for new moms or even regular, seasoned moms, even for seasoned moms, when we
Mhm.
do this breathing, and even for,
Mhm.
men too, when you diaphragmatically breathe, it helps engage your core,
Mhm.
right? So, lots of people out here promoting these waist trainers. Don't do it. It's terrible for your pelvic floor. Just a side note.
That was actually, we can talk about that a little bit more because and men and women we use those now too. So
Yeah,
yeah, that's gonna be a topic after we finish
yeah.
in the breathing.
But the thing is, we have our own natural waist trainer,
Mhm.
and that's the transverse abdominis muscle, right?
Mhm.
So we have layers of abdominal muscles. So
Mhm.
the innermost layer is a transverse abdominis, and it's like a big corset muscle that wraps all the way around,
Right, right.
right?
Mhm.
Then we've got the obliques, internal
Mhm.
and external, that come off the ribs. And then we
Mhm.
have the rectus abdominis, the six pack muscle that comes
Right.
down the front,
Mhm.
right?
Mhm.
When we diaphragmatically breathe and we exhale up and out,
Mhm.
that activates your transverse abdominis and brings those abdominal muscles together. So
Mhm.
for those ladies with diastasis recti, where their abdominals are separated, start
Right.
with breathing. That will
Mhm.
help engage those muscles, right?
Mhm.
Even men, because men get diastasis recti too.
Really?
Hmm.
I didn't. How does that happen?
So a lot of times, so you know how we talked about that pressure, right? When we're
Mhm.
breathing. So
Mhm.
we inhale, we exhale.
Mhm.
So pressure will go to the area of the least resistance,
Mhm.
right? Most often, especially with men, a lot of times they're lifting things heavy.
Mhm.
A lot of times they're holding their breath,
Mhm.
right? Um, they're also sometimes they have big bellies,
Mhm.
and so that increased area can separate, especially when they have increased pressure. So
Mhm.
if I'm going to lift something,
Mhm.
that's heavy,
Mhm.
and I hold my breath, what I'm doing is I'm
Right.
creating that pressure,
Mm,
right?
right, right.
Now, if I've got weaker abdominal muscles,
Mhm.
guess what happens?
Mm, mm,
Then it's
yeah.
going to go
So,
and create
okay.
some space. So for
Mhm.
people who've had hernias,
Mhm.
right? Abdominal hernias, inguinal hernias, groin hernias, umbilical
So,
hernias,
yeah, yeah.
it's a pressure thing. Oftentimes
Mhm.
it's a pressure thing, right?
Mm,
But when you're breathing with your diaphragm and engaging that transverse abdominis, it's creating tension across those abdominal muscles and giving support,
mhm.
right? And so the body's really efficient.
Mhm.
It's like super efficient, doesn't like to waste any kind of energy.
Mhm.
So, if you've got weakness in your core, rather than engaging the muscles you need to, unless you're being intentional about it, the
Mhm.
body will use pressure to create stability,
Mm. Okay. Okay.
right? So when you exhale during like the hard part of your exercise, so if you're
Right.
lifting, rather than going, go,
Right. Right. Right.
that's going to activate your tummy muscles, give you the
Mhm.
support you need
Mhm.
without creating extra pressure on your pelvic floor
Mhm.
or
Mm.
your tummy.
Interesting. So start with breathe. If you're going to do anything, and we were talking about Kegels earlier, stop the Kegel,
Stop,
breathe,
please.
and breathe.
Breathe.
And
Stop
breathe
Kegels and
because
breathe.
the breathing actually help, depending on what's going on with you, actually help put things back in place a little bit, while the Kegel
Mhm.
can actually be detrimental because we don't know exactly what is going on. So start breathing, then get your referral if you need to, but get to a um, pelvic floor uh, physical therapist, right? And
Mhm.
then they can help you with that. I do want to touch. So I had the question about the waist trainers and all those things because everybody wants to look nice and tight. Me too. But I always felt like those things were like just so constricting and maybe putting things out of place, and as you're saying, is hurting the muscles and so on. So can you touch on that some,
Yeah.
for those who use them or thinking about using them, and what can you do?
Yeah, absolutely. So with So I'll use an example,
Mm-hmm.
right? Because we've been talking about pressure and
Mm-hmm.
things like that, right? So if you had a balloon that was blown up,
Mm-hmm.
right, and you squeeze it in the middle,
Right.
what
Mm-hmm.
happens? You're going to have a big bulge of pressure here and a
Right.
big bulge of pressure here. And that's
Mm-hmm.
what a waist trainer does.
Mm-hmm. Mm-hmm.
It squeezes everything in the middle, and
Right.
it's going to create a lot of pressure and tension in your pelvic floor,
Mm-hmm. Mm-hmm.
right? And so the issue is that it doesn't allow your muscles to work for you,
Mm-hmm.
right? And we were talking about efficiency, right? This is why I'm not huge on like braces, wearing like back braces all the time.
Mm-hmm.
You know, if there's, you know, if you have a job where you have to do repetitive lifting,
Right.
okay, that's
Mm-hmm.
fine. You need that support.
Mm-hmm.
But for people that just wear back braces
Walk
all the
around with them.
time,
Right. Right.
like the body's so efficient. It's like, oh, something else is gonna work for me. Cool, I'm gonna chill.
Right.
Right. And then you take it off and you feel like a limp noodle. And you're
Mm-hmm.
like, oh, I gotta put my back brace on because I'm no, you need to take it off and let your muscles do the job for you.
Mm-hmm.
Right. A lot of people want these waist trainers because they want an hourglass figure.
Right. Right.
Are you made naturally that way? Is that not
Mm-hmm.
everybody's an hourglass?
Right. Right.
Some
That's
people are
true.
apples, some
Mm-hmm.
people are pears, some
Right.
people are boxy,
Mm-hmm.
right? God made you that way. That's how your body is.
Mm-hmm.
It's okay, right? We all
Right.
want flat tummies. I'm
Mm-hmm.
fluffy. I'm a fluffy girl. I get it. I want one too.
Mm-hmm.
But wearing that waist trainer is going to cause other issues, right? Because let's say, because a lot of people wear their waist trainers when they work out.
Mm-hmm.
So let's say you've got your waist trainer on. So you're squeezing your balloon in the middle. So you got lots of pressure here, lots of pressure here. And then you go lift weights. And then you hold your breath.
Mm-hmm.
Right? So now we're getting more pressure, more pressure, more pressure.
Right.
So guess what happens? People end up with prolapses, which is
Mm-hmm.
basically when their pelvic organs start descending.
Right.
So you start having a bladder prolapse or a uterine prolapse or
Mm-hmm.
rectal prolapse. So now you're having difficulty emptying your bladder, or you're leaking, or you feel like a bulge like in your
Mm-hmm.
vaginal area, or you
Mm-hmm.
feel heaviness or pelvic pain, all of those things.
Mm-hmm.
Now, why would you do that to yourself? Why would
Mm-hmm.
you set yourself up for pelvic floor issues? You
Right.
know, especially like if you're a mom, your tissues have already been stretched after having babies, and then you're going to
Mm-hmm.
put more pressure on it.
More pressure on.
Okay.
Right. And isn't that from what you've been explaining, when you're working out and you have that on, then you're not allowing the muscles to actually work out, right? So it's actually counterproductive. It's hurting you because it's displacing things, but also it's not, you go into the gym for kind of like usually we go because we want to lose weight and have the flat tummy, but it's actually not, you're actually not working the muscles that would help you have the flat tummy because they are all wrapped up in that waist trainer. Is that correct?
Yeah. So it doesn't allow your body to
Mm-hmm.
optimally utilize your muscle function,
Right,
right?
right.
Because it is providing a level of stability because it's a brace,
Mm-hmm.
right? And so while your muscles will function, they're
Mm-hmm.
not going to function optimally,
Right, right, right.
right? And if you're working out, you
Mm-hmm.
want your muscles to function as well as possible.
Right.
Excuse me.
Yeah. Because then you have risk of injuries also and all those different things
Mhm.
coming into play. Yeah. That's very
Absolutely.
interesting. Yeah, it's something that I wonder because I see them getting tighter and tighter, and I think that we're going back to the whatever age where people were wearing those, and it got to a point where you did have to wear them so tight, and then they had the extension for the hips because they wanted to like very very narrow and then have
Yeah.
those the hips, and so
Yeah.
it's
And you
definitely
also,
getting to that point, but it's uh hurting our rib cage, it's hurting the organs in there and so
mhm.
on.
Yeah, there's a whole space there.
Hmm.
So when you wear that, then it doesn't let your lower ribs expand,
Hmm. Hmm.
so you're not going to get a good diaphragmatic breath because there's not as much space for it to go.
Hmm.
Your GI system can't function as well because it's kind of all smashed in there. There's just
Right,
a lot of different things that, it
right.
causes more problems than you really need.
Mhm.
Unfortunately, um, some of those consequences may not show up for several years later.
Mm,
And
okay.
so, people say, "Oh, I'm fine. I
I'm
don't feel
fine.
anything. I'm
Right.
good." Okay, I'll see you
Right.
in 10.
Right.
Like
Right.
that,
Unfortunately,
it is
yeah.
what it is.
Right.
It's
Right.
not good.
Yeah. And for some, they'll say it's still worth it. But
And that's their
it
call.
gets to be painful. I can see that. Yeah. Yeah. That's interesting. So we talked about always, my hours always go so fast, but we talked about so the pelvis area. We have the common cause of dysfunction that we can all think about of childbirth, of injuries, of prostate issues. But you also talked about how stress can affect our pelvis area, how when we talked about weight that we have on, and all kind of other different health issues. Can the back pain and the shoulder pain and the different tension that we have in our body, and then how does it show up? You said uh, bowel issues, urinary issues, digestive issues, pain, of course, of course, during intercourse, but also just pain as you go through lifting things or sitting down or running, walking, laughing. So it comes in different ways. And from what I'm hearing is, we not being afraid of doing the assessment and doing the work that comes with it for a long lasting outcome, and then breathing. Breathing always comes back up for some reason. Breathing and from the diaphragm, from it, you said the 360
Hmm.
breathing, and tell us again what does that look like? What should I maybe feel? For me to know that I'm involving all the different parts for breathing there.
Yeah. So you can start by just having one hand on your chest, one hand on your
Hmm.
tummy.
Hmm.
And as you're breathing in through the nose, out through the lips, you can see what hand rises and falls first.
Hmm.
And then try to let them rise and fall together.
Yeah,
Try
that.
to get them to where they rise and fall together. You can
Mm-hmm.
even put your hands on your sides, on your lower ribs,
Hmm.
and see if you can breathe down into your ribs and get those things to expand.
Mm. Okay.
You might find that might be a little hard to get your breath down there, especially if you've been a chest
Without
breather.
forcing. Yeah.
Yeah, exactly. It's like, oh man, but being able to expand down that way.
Hmm. Hmm.
And then, if you're pretty aware of your pelvic floor, you can also think about breathing all the way down to your pelvic floor because your pelvic floor lengthens and goes down to the basement when you inhale. So you should feel a little like pressure or opening of that area
Hmm.
as you inhale, and then as you exhale, it kind of comes back up.
Back up.
So those are kind of some
Hmm.
things that you can do to start trying to see how you're breathing and to just start
Hmm.
breathing more deeply.
Hmm.
And the cool thing about breathing is you can do it whenever because it's kind of essential to life.
Hmm.
And just really practice. Just practice.
Nice. Yeah, I think I'm sorry. I think the practice, and I would say I am one when I have to go to physical therapy. It's always like I just do the same thing 10,000 times,
Oh
but
no,
it
where are you
feels that
going
way,
to?
because you're like, lift this, like
Yeah.
and it feels like okay, and then you go home and you have to do the same, lift this leg, lift that leg, and do this and do that, and but then the result is the result, and so that's the part, that I always have to remember. It's like, okay, I have to do those things, and yes, it may be repetitive, or some physical therapists make it more exciting, than others. um and so but then we see, again, long term, and then the well-being that you get, even after a few sessions, you start noticing the difference. So that's really, really important. So I do want you to give us a last word, and I do want you to tell us how we can find you, specifically, I do have a viewer that says, "Love the books organizing."
Oh, thank you.
So yeah, that's also the first thing I saw. I was like, "Oh, this is a nice way to organize the book, make it more lively."
Yeah.
But so I don't, how did you get, into this specialty, because it is a specialty, and again, what last word or encouragement or advice that you can give to our
Um,
viewers today?
yeah, so typical PT type story.
Mm-hmm.
I had a kid. My son was 10 pounds, 1 ounce. So he was a
Mm.
grown man. Um, and so I ended up with a lot of pelvic floor issues.
Mm-hmm.
And diastasis recti and hernia and things like that. And so I found my way to pelvic floor physical therapy
Mm-hmm.
for myself. And I was like, I should be doing this.
Right,
Um,
right.
and so that's what started me on that journey, and I love it. I
Mm,
absolutely love it. But yeah, so you can find me on Instagram and Facebook as Dr. Lexi Harrigan. My website is pelvispower.com. That is my
mhm,
practice.
mhm.
Um, so I'm also there as well.
Nice, nice, very nice. And so pelvis pelvis power um,
Pelvis Power.
.com in Texas, in
Yes,
the Dallas
yes, I'm
Fort
in the
Worth area.
Dallas Fort Worth area.
Hmm.
Yes.
Okay. And so any last word, of advice for our viewers, any encouragement or tip,
Yeah. If
anything that you want to leave with us?
Absolutely. If you're having these issues, you don't have to live life like that. There's
Mm,
treatment for you.
right.
And it doesn't have to be, you know, it doesn't have to just be, oh, you don't have to excuse it or anything like that. Go get treatment. It's
Mm-hmm.
there for you. And your therapist will listen to your story. Um, there's so many patients that we've had that have been not listened to, not heard. These are one-on-one treatments. We do a lot of talking because we want to, and we do a lot of listening because we want to
Mm-hmm.
hear your story. If you're
Mm-hmm.
telling me you hurt, I believe you.
Mm-hmm.
You're not crazy and you're not broken.
Mm-hmm.
What you feel is real and you deserve to have the treatment you need.
Nice. Yeah, yeah, that's very true. That's very true. So, thank you. Thank you very much. Thank you for those words of encouragement. And I hope that this was useful for you guys who've been watching. If you're watching on the replay, and if you have questions, always put your questions and comments your questions in the comments. And then Dr. Lexi's here to catch on those. And I am also, if I need to redirect to her, I'll make sure I do that. So, any questions, any comments? And I hope that this really was enlightening. It was to me. And so, thank you for teaching us, for sharing with us. And yeah, get to the power, how you has it on your shirt, power to the pelvis. So,
That's right. Thank you so
awesome,
much.
awesome. Thank you guys. Thank you for joining us on this edition of 39 Down, our Mind Body podcast. And I will see you guys next time.